As you will clearly gather, I am the unhealthy health minister. Now, forgive me, because good news is, for a lot of people, I'm actually losing my voice, so I'm not going to speak for very long. Rory, thank you very much indeed for your introduction. I am indeed an East Midlands MP, in fact, born and bred in the East Midlands. I've spent the vast majority, I think only about 8 years of my life, not living in the East Midlands. I'm an MP for Nottinghamshire, MP for Broxtowe, just to the west of Nottingham. However, I remain a fan of Leicester, if for only the reason that I come and watch Leicester Tigers play, being lucky in the lucky position to be a season ticket holder. So I know this city, as indeed I know most of the cities in the East Midlands. And I think what you're seeing today is a bit of a first in this respect. You're seeing all the political parties coming together on this. This is not an issue that divides political parties. It's a bit of a non-brainer, isn't it? It's a bit obvious that if we are to do all the things that we want to do, and we are all agreed, we want people to live longer, healthier, happier lives, then we have got to start to build on the legacy that's been left, or should be left, from a fabulous summer of sport. Work together across government, and Rory referred to that in the way that things are happening here in Leicester at a local government level, also nationally. That's why it's so important that when Norman Baker asked to see me, when I'd just been appointed as a minister in the Department of Health, as the minister responsible for public health, he asked to see me and he said, look, I'm going to the Active Travel Conference because it's a bit of a no-brainer, isn't it, that something which is dear to his heart in his Department of Transport is obviously dear to my heart as the Minister for Public Health. So he said, would you come along and can we do this together? And I didn't hesitate to say, absolutely, yes. I want to do that because it is, as I say, so very obvious. But just to remind you that we know, and it's deeply ironic, that we face the very real prospect in the developed world of having, and in this country, where our obesity and levels of people being overweight are some of the worst the worst in Europe, especially amongst children. These things should seriously concern us because we are in real danger for the first time ever of having a generation that is at risk of dying not through malnutrition but bizarrely from overconsumption. And we know that being inactive is one of the biggest killers in developed countries. And in England, because health, as you know, is a devolved matter, but in England, we know, and I'm referring to figures that have just that show, only 40% of men and only 28% of women manage to reach the guidelines of activity. We know that that is obviously something that's very, very, very bad news, and we have to change that. We have effectively to get people off the sofa, out of their cars, and start to be more active. It's not just about sport. I mean, we want to have a real legacy from the Olympics, as I say, a fabulous summer of sport. And yes, I want more people to play competitive sport, but I know it's not as simple as that. I was very encouraged when shortly after the Olympic Games, I think it was Sky that showed in a survey that more people had gone to look at cycling, no doubt inspired by Bradley Wiggins, no doubt inspired by Victoria Pendleton. And yes, I hope some of those people take up competitive cycling. I actually don't care whether it's competitive or it's just getting on a bike or getting a bike, the use of a bike, to travel to work, or not to use their car as often as we know we all do, so that they use their bicycles to go down to the shop or to come into town and to go to the cinema, whatever the activity might be. It doesn't have to be competitive sport, but it does have to be about people living a better, healthier, more active life. Now, Rory referred to the big changes that are going to take place in public health. And I'll be very frank about this. It sometimes slightly concerns me that perhaps people are not as aware as they should be about what is coming in April. And although the act that went through Parliament earlier this year was hugely controversial, luckily I can park that bit because the public health changes that were made were largely completely uncontroversial, and they were very much welcomed by local government because it's some 40 years since local government was responsible for public health, and we've changed that. So now it's beholden upon local authorities to deliver on public health. I'm encouraged by what I hear from the unitary authorities like Leicester. You know, and frankly, people like Rory clearly get it. He's been responsible for transport, now he's responsible for public health. And he understands this great and golden opportunity to make local government work better together to deliver on the important work that has to be done to improve our local community's health. And one of the reasons why I'm so enthused by the fact it will be coming back to local government is because, frankly, I believe that local councillors, good local councillors, are best placed to know and understand the needs of the people that they represent and that they serve, to make sure that they deliver on improving their lives when it comes to health. And local councillors are best placed to know and understand their wards. And I want them, in many instances, to be angry. I want them to say, oh, this is not acceptable, because we will begin to publish the data. Now, at the moment, of course, it's not the responsibility of local authorities, so they have nothing to fear in the publishing of that data. But I want people to say, it's just not acceptable that in a particular part of a particular city or in a particular part of a particular county that we have very high rates of obesity, or we are not tackling huge problems, say, with smoking. And for them to say, so what can I do as a local councillor? Well, there's actually an awful lot, because of the movement back to local authorities, now that local authorities not only can do, but will have to do. And I think that, to use that expression, the drivers of change in public health will be councillors. And I use the example of what will come in May, when so many of our shires, not here in the city and the unitary authority of Leicester or indeed in Derby, not even in other cities, but in the shires, when we go to the polls next May, I want to see on the front of whatever the political party is that a candidate may or may not support, but whatever their political party is, I want to see on the front of the leaflet their agenda, their manifesto on how they are going to improve the public health of the people in that particular ward which they seek to represent. It's a real challenge. And I think it's great for local government, because as somebody who's never been involved in local government, I hold my hands up to that. And one of the things that from talking to councillors, the conclusions that I've come to is that we've taken away a lot of power from councils. And to put that power back, I think is great, because it means that councillors will say, do you know, actually, at long last, here is something where I actually can make a difference, not just across the authority, but specifically in my ward. Rory touched on health inequalities, and we know that we have a real problem in this country with health inequalities. And that's why I was so pleased to see in the Act that went before Parliament that is now in law. There is now a statutory duty upon the NHS, upon all of us involved in the delivery of health, to reduce health inequalities. So in cities like Leicester, where I know and understand the real challenges that people here face, now they have that statutory duty. They have to reduce the health inequalities. So I am delighted to be at this conference. I will draw my remarks to a close by saying that we know in the NHS that there is so much that we have to do in our own workforce to make sure that we actually practice, frankly, some of what we preach. And there are very good examples of where NHS workers are being encouraged and taking up the challenge themselves to do more activity. And we also know, of course, that it's not just about the cost to individuals' lives of inactivity, the damage and harm it does to us as individuals, to our families, but also, of course, frankly, the cost to the public purse, because it's the NHS, it's us as taxpayers that often pick up the tab. So we want to do this for the sake of individuals, their families and their communities, but also for the sake of our public purse as well. And I'll just finish off by saying this. I don't cycle as much as I used to when I was younger, but I do walk. And I know and understand the benefits of walking. I'm very lucky. I go walking, obviously, in my beautiful constituency. But also I go walking in Charnwood Forest, which is an astonishingly beautiful part of Leicestershire. And if you don't know it, you really should do. But I just wanted to say that, yes, you can walk in our beautiful countryside, but as Rory said, you can walk in our cities. Frankly, I think there is no better way than to understand a city than to walk it, whether it's along the canals or whether it's to walk along the streets right in the centre. Not only do you see wonderful things, you pick up history, you also capture the smells of a particular city that can excite you and delight you. It's a wonderful way to explore another part of the country that you may not have been to before, or just awaken your own eyes in your own town or your own city if you actually get out of your car and you go and walk it and enjoy it. So, as I say, it's a win-win all round. Thank you very much for inviting me. I hope you have a great day. And I think this is the beginning of more work that we will see across government, both nationally and locally. Thank you.